Hello, this is part of our assignment and we're gonna present about visual impairments. So I'm gonna start sharing my screen with you guys and we'll start the presentation. Can you guys see my screen now?
Yes.
Yes.
Okay, and we are gonna present about visual impairments. And in our team, we have David Rolle, myself, Joshua Jimenez, Anahi Monroe, Stephanie Bart, and Marcus Rolle. So visual impairments is a vision loss in which a person cannot see anything or has partial vision loss. Vision impairment may be caused by a loss of visual acuity, which means that the person's eye cannot see objects at various distances. Also, it might be visual impairment could also be caused by a loss of visual field, which means that the person lacks peripheral vision. Individuals with visual impairments. The IDEA definition of a visual impairments includes blindness is defined as impairment in vision that even with correction adversely affects an individual's educational performance. That includes both visual impairments and blindness. The classification of visual impairments is that children are eligible for special education services according to vision loss and how the vision loss affects educational performance. Visual impairments include a reduction of visual acuity, which is the ability of visually perceive details of near and distant vision or restriction in the field of vision. Legally blind, the federal definition of blindness is a visual acuity of 20/200 or less in the better eye with correction or a visual field that is not greater than 20 degrees. Functionally blind, it's a primary channel of learning that is through tactile or auditory means. This means that individuals use Braille as the primary literacy medium and require orientation and mobility training. Low vision, it's a visual impairment that interferes with ability to perform daily activities, such as learning, or learning is through visual means with the use of prescription and non-prescription devices. The history of visual impairments. In 1784, 1784, Valentin Hauy established the Institut National de Jones Aveugle in Paris, which is an institution for blind youth that it was for the first school for education of children with vision loss. In the 1800s, Louis Braille developed an embossed communication system known as Braille. 1829, the Perkins Schools for the Blind in Boston was established. 1833, Overbrook School for the Blind in Philadelphia, and it was a residential schools opening in the US. The 1900s, children with visual impairments served by various agencies such as hospitals, rehabilitation and residential schools. In 1950 and the 1960s, residential and public schools options emerged to meet the educational needs of the child. The etiology of visual impairments, prevalence, which was 23,000 children ages of between 6 to 21 years old were receiving services in the 2013-2014 school year because of visual impairments. Etiology, mostly genetic in source, cerebral palsy, congenital cataracts, difficulty delivery resulting in Apgar scores, maternal infections during pregnancy, such as rubella, herpes, cytomegalovirus, and toxoplasmosis, prematurity or low birth weight, and strabismus. The prevention of visual impairments are prenatal care can prevent eye problems. Early screening and diagnosis can determine the prognosis for visual impairments. Early detection, the eye examinations shortly after birth, at 6 months of age, before entering school, and periodically throughout the school years as an eye safety. Assessments of students with visual impairments are comprehensive assessments required that includes a screening for visual acuity provided by the school or in a physician's office, referral to a licensed ophthalmologist or optometrist for further evaluation, interpretation of data by evaluation team by a trained and certified teacher of visually impaired. Clinical low vision evaluation necessary to determine if a student could benefit from other optical or non-optical low vision devices. Low vision examination includes acuity test, visual field testing for peripheral or central vision loss, interview with the individual to determine what the student can do for work, school, and leisure activities. Functional vision evaluation is the evaluation to see how well a student can complete a specific task. That includes observation to see what the student does as an individual and also as in group activities. Travels in the school environment are part of the functional vision evaluation. Literacy media refers to the sensory channels and preferred method of reading and writing, such as print, braille, or both. Now, the types of visual impairments are central vision loss, peripheral vision loss, and blur vision, and visual disorders following a brain injury. And my friend Stephanie is gonna follow from here.
All right, thank you. Central vision loss is the loss of detailed vision. Individuals with central vision loss have difficulty seeing detailed shapes, face recognition, colors, reading, writing, and performing precision work. Such individuals still maintain the perception of space and movement, which allows them to move around without assistance. Central vision loss etiology is typically the result of damage to specific tissues and structures within the eye, which can originate from multiple causes, including macular degeneration, glaucoma, or cataracts. Central vision makes up only 3% of a person's total vision field. All right, peripheral vision loss is also known as tunnel vision. Individuals with peripheral vision loss have central vision acuity. However, their vision is limited to what is just around the eye's visual point of fixation. Typically, individuals with peripheral vision loss are able to read. However, they lack global perception of their environment, and their eyes are unable to follow a moving object. For some individuals, said vision loss can be disabling as they have trouble navigating independently. Peripheral vision loss etiology can include eye strokes, retinal detachment, retinitis pigmentosa, optic neuritis, papilledema or optic nerve swelling, concussion, traumatic brain injury, and brain damage from stroke or disease. Blurred vision is a visual impairment in which everything the individual sees would be equivalent to looking through a frosted glass. Individuals with blurred vision can only vaguely perceive shapes, cannot be precise about the contours of objects, and have difficulties with distance and depth. Further, individuals with blurred vision are very sensitive to bright lights, have difficulty reading, writing, and global movement in their environment. Blurred vision etiology can include refractive errors, age-related macular degeneration, cataracts, diabetic retinopathy, stroke, high blood pressure, bleeding inside the eye, retinal detachment, concussion, infections of the eye and its tissues, and migraine headaches. A common a corneal abrasion caused by a scrape on the surface of the cornea can also cause sudden blurred vision. Blurred vision that worsens gradually is usually caused by long-term medical conditions. Okay, visual disorders following brain injuries are visual impairments caused by trauma or brain damage that is usually associated with attention, memory, and behavioral problems. In most cases, visual impairments are subsequent to sustaining a brain injury, not the visual function itself that is impaired. Instead, the ability of the brain to analyze information affects the vision function. Characteristics of learners with visual impairments are squinting, frowning, blinking his or her eyes during reading, inability to see objects or written at a distance, inability to see objects or writing at a distance on a blackboard or whiteboard, extreme light sensitivity, holding objects close to their eyes, inability to focus or follow an object and rub their eyes frequently, blurred vision, chronic eye redness, and or bumping into objects frequently. Characteristics of visual impairments. Visual impairments can affect the type of experiences the child has, the ability to travel within his or her environment, and participation in their community, my goodness. Intellectual capabilities are similar to sighted peers. However, significant academic delays are not uncommon in learners with visual impairments, likely due to restrictive opportunity to obtain information visually. Incidental learning is severely limited. Socialization delays, social immaturity, and feelings of isolation and low self-esteem. The student may exhibit repetitive bodily movements such as hand flapping, head waving, twirling, eye pressing, and rocking. Travel skills restricted and may require assistance such as a cane, dog, or sighted guide, and require orientation and mobility services to teach skills to orientate persons to surroundings and move independently. Vocational skills must begin at early age as they require assistance to dressing, eating, cooking, telling time, and other events of daily life. Face impairments of quality of life issues that differ from other disabilities. All right, characteristics continued. The visual impairments affect each child differently, depending on the grade of the disorder. A child with low vision has experiences that are different from that of a totally blind or legally blind child. Some of the characteristics of these visual impairments affect in the classroom are marked on the checklist that was developed by Optometric Extension Program Foundation. This way, teachers can make reliable observations on their students' visual behavior. Some of these characteristics are holding reading materials extremely close to the face, frequent headaches, confusion writing letters and numbers, difficulty in keeping up with reading and writing, misaligning columns when working on math problems, difficulty copying from the board or transparencies, difficulty in color coordination or color identification, poor posture while sitting or standing, poor grades, behavioral problems, requiring additional time to complete tasks, unwillingness to participate in physical and social activities. Okay, so David is going to continue with educational considerations.
Hello, everybody. Thanks, Stephanie. Okay, as far as for educational consideration, students with visual impairments require an EP to help them prepare for independent and productive lives. Their educational goals are defined by the needs of the students and the family. Now, almost 7 out of 10 students with visual impairments are able to take classes in general education classrooms during the period from 2016 to 2017 school year. Now, also 12% of students with visual impairments were assigned to a resource room. Also, 1 in 10 students were educated in a separate classroom. Now, continuing on with instructional consideration. Now, students with visual impairments have the same goals as the rest of the students. Their instructional goals are mostly include academic progress, employability, communication skills, social competence, and independence. Now, the IEP team has to decide how the goals named above will be accomplished either in an array of low vision devices according to the needs of the student, or to decide if the student's needs materials to be either enlarged or to be put into Braille. Also, whether technology will be needed, excuse me, such as taking a calculator, abacus, or low vision devices. The need of direct specialized services vary throughout the student's education. It all depends on the goals of the student and how they will be able to meet in the classroom. How they will be met in the classroom. The expanded core curriculum is the body of knowledge and skills needed by the students with visual impairments because of their unique disability specific needs. Visually impaired students need the expanded core curriculum, also the core academic curriculum. Expanded core curriculums. The expanded core curriculum is the body of knowledge and skills needed by the student with visual impairments because of their unique disability and specific needs. Visually impaired students need the expanded core curriculum and also the core curriculum that is used in general education. The expanded core curriculum is the framework to assess students, to plan individual goals, and to help provide instruction. The academic curriculum must be modified to meet the individual needs of each student, so progress is based on skill level and the completion of expectation in on each area. The teacher of students with visual impairment can provide support to the teacher in obtaining instructional materials in order to ensure the students with visual impairments have full access to the content that will be presented in class. Again, continuing on with instructional consideration, the expanded core curriculum. Now, typically content of this curriculum includes the following. Usually some sort of assistive technology, career education, competency skills, independent living skills, orientation and mobility, social skills, self-determination, recreation, and leisure skills. Now, specialized areas of the regular curriculum that are considered appropriate for students with visual impairments are music, art, family, and consumer sciences. The use of auditory or tactile experiences can help achieve the modifications and accommodation of the student. Now, as far as regarding the orientation and mobility, some students with visual impairments may also require instruction in orientation and mobility, which are related to service according to the IDA. Orientation helps students to be aware of where they are, where they're going, which route to take to get there. Mobility is moving from place to place. The orientation and mobility training includes sensory training, concept development, and motor development. The person that can evaluate the student's functional level and prescribe specific training is a certified O&M specialist. Now, as far as regarding the technology and individuals with visual impairments, now the technology provides opportunities for students with visual impairment to participate in programs on a level with sighted peers. Now, as far as visual impairment, students need to assess through an assistive technology assessment to help the student get specialized materials according to their needs and allow full participation in a less restrictive environment. Now, assistive technology can be introduced to students at an early age. Now, these devices can help students to complete successfully the educational programs. These devices and methods of access are electronic Braille devices, also the Braille displays to access internet and to print mountain beaten Braille or Brawler, Braille translator, Braille writer, optical character recognition, synthetic speech, electronic magnification, and e-text reader. Technology helps students with the ability to become as independent as their sighted peers. Now, as far as the types of assistive devices for learners with visual impairments in the classroom, we're talking about, large print books, calendars, worksheets, vocabulary cards, also the handheld magnifiers in large text and images, also audiobooks. They can be screen readers and text-to-speech devices, tactile keyboarding, portable note takers, full-page writing guides, placed over paper to help them stay within the writing space. Could be colored transparency, an accurate film over text to provide less page glare, variable intensity study lamps for illuminating material more effectively. It could also be a night rider pen with built-in lights for illuminating study material. Now, as far as the educational service across the lifespan, the thing is, we want to kind of just focus on the early child education for children with visual impairments. It's not only on visual and auditory tasks, but also the development of skills. Early intervention is critical for the development of age-appropriate skills. The early intervention team is available for children from birth to age 3 and helps to assist the family with activities that can stimulate each of the developmental areas. A transitional plan must be designed no later than age 16 and reviewed annually for the adolescent with visual impairments. Typically involves vocational and educational opportunities, travel skills, or activities of daily living, in addition to acquiring social and opportunities, travel skills and activities of daily living, in addition to acquiring social and and interpersonal skills, community participation, independence on the job, and among other goals. Now, adults with visual impairments are often isolated from peers in their community. Leisure and work support is vital for community integration of adults with vision loss. Okay, so I'm going to go ahead and let Miss Anahi Monroe, she's going to take it from there.
And I make sure you're not muted.
Sorry, I am nervous. Sorry. Okay, we talked about the transition for post-school for the person with visual impairments, okay? Consideration for preparing learners with visual impairments for post-school transition. The goal is for students to be successful post-high school. For students with visual impairments, the transition process should be included in the individualized education plan, IEP, by 18 and by age 16 and update annually. The teachers, students, parents, guardians, and ancillary staff should be decide which service will be beneficial to the student for post-secondary transition. Discuss relating to independent living, work, college, and vocational training are common topics of discussion. Specialized classes, mobility training, community-based related experiences, and information about the various community resources are a few of many things that could be included in IEP as part of the transition plan, okay? Transition service and programs, New Mexico Commission for Blind. These services is in New Mexico. The Commission for Blind provides vocational, rehabilitation, and independent living services designed to enable persons who are blind to become more participant and contribute members of society. Blind people lead normal lives, have families, raise child, participate in community activities, and work in a wide range of jobs. They are secretaries, lawyers, teachers, engineers, machinists, scientists, supervisors, and business owners. The real challenge is to educate blind people about their own potential and to educate society about the capabilities of persons who are blind. The Commission believes blind people are normal and blindness is in an itself should not keep a blind person from learning a productive life. The Commission provides services that enable blind persons to enhance their abilities and assume roles in the community as work, taxpaying, and contributing citizens. The State Rehabilitation Council, SRC, works in close partners with the Commission, be helping to formulate vocational rehabilitation policies and priorities. The Commission works diligently to provide transition service for blind children and young adults with the goal of enhancing the quality of their employment outcomes. The Commission has memoranda of understanding with a New Mexico School for Blinds and Visual Impairment, the Public Education Department, and the Department of Health, all of which are designed to enhance transition services, reflecting to the importance the Commission places in the education of all blind children. The Executive Director served on the Individuals with Disabilities Education Act, IDEA. a state advisor panel, and in addition, and commission deputy director. Okay, the students in transition to employment program, STEP, provides blind students with a careful, monitored, and quality employment training experiences. Blind students have traditionally not had an opportunity to earn and work training, depriving them in the important benefits of students' employment. STEP served 24 blind students rating and acquiring a positive attitude about blindness is essential for blind person to achieve the goal or become successful employee. The students also participate in seminars and presentation from successful blind adult role models served on the State Transition According Council. Accreditations. The Orientation Center provides 24 persons with intensive training in the skills of blindness. The center is certificate and accredited residential program designed to equip blind person with the skills needed to become employed. Most of the center's students are persons who are newly blinded. The center is located in Alamo Gordo. During the year, the center achieved full accreditation for the Commission on Accreditation of Rehabilitation Facilities and full certification for the National Blindness Professional Certification Board. The program. During a typical 6 months training period, students receive intensive training in cane travel, braille, assistive technology, home management, personal management, and industrial arts. The center training is built around the use of sleep shades to eliminate the desire to really and inequity of failing vision. By learning effective non-visual techniques, students gain self-confidence and learn how to functional and successful blind person. One of the students asks learners to alternate techniques of blindness. He or she is able to decide when, how to use remaining vision. Assistive technology. The use of assistive technology is a crucial factor on the successful employment of persons who are blinded. However, according to a 2000 study, only 24% of persons who are disabled own computers, compared to a national average of over 50% according to 2003 study. Fewer than 30% of persons with disabilities access to the internet, compared to the more than 60% for persons who do not have abilities. This gap is the digital device. The Commission Assistive Technology Program is helping to bridge this gap. A blind person must learn to the application as well and then assistive technology that allows access to application. 1127 received personal tutoring. Thank you.
The Commission's technology statement. This provides consumers with screen readers, braille displays, screen magnification programs, video magnifiers, and braille note takers. The assistive technology is indeed meant for their individual employment needs, often only in small charge, indeed needed to make a blind person's job much easier and more competitive. The Business Enterprise Program, BEP, provides employment opportunities for blind individuals who wish to operate food services. The BEP has establishments from small food stands to vending routes to full military cafeteria at Kirkland Air Force Base in Albuquerque. BEP also serves in food and dining needs of the Federal Law Enforcement Training, FLETC, in Artesia. The BEP needs of federal enforcement training, the BEP provides public government employment with quality food services that is conveniently located within government buildings. 25 blind participants in the BEP program, and vendors earning were 4,042,401, contributing 202 120 in grossing receipts taxes to the state. The independent living / older blind program. This is enables blind persons to live independently in their homes and in their communities. To accomplish this, the direct services are provided to most persons being served in the home. The independent living or older blind program individuals intensive training to 549 individuals and basic service an additional to 331 person the majority of persons served were 55 and older. The independent / older blind living program include 8 independent states reach out to underserved populations in rural areas. They are provided training and guided to encourage and consumers assistive to active and productive lives, including individuals who participating in commission vocational rehabilitational program. Individuals includes training in Braille, how to travel using white cane, how to use Newsline. A telephone-based system allows persons who are blind to access a variety of newspapers and publications, average more than 10,000 calls per month, served over 5,000 users statewide. The commission also sponsors NFB Newsline, a program providing access to over 300 national newspapers. Vocational rehab program serves persons who are legally blind and certain qualifying individuals with significant individual impairments. Trends, issues, and controversies. Some of the trends, issues, and controversies that directly affect children with individual impairment. Teacher shortage numbers, visually impaired students assigned to teachers, access to served O&M specialists, technology teachers, shortage in the field, visually impaired